Psychiatric pharmacists play a vital role in mental health care, and this field can offer an immense amount of job satisfaction. But did you know that they are often paid less than their other counterparts in other clinical professions? And it may make you wonder, like, why is that? What are they doing wrong, or what's wrong with the job market? And should I consider being in this field if it's all that it's cracked up to be? This may make you wonder, why is such a vital role undervalued by the marketplace? Could it be that the satisfaction of the role is outweighing the drawbacks of a lower salary? Maybe. Hi, I'm Alex. I'm the founder of the Happy PharmD, where we help pharmacists get into careers that they love through career coaching. And in this video, we'll be talking about what psychiatric pharmacists do, job satisfaction, salary, job demand, and of course, flexibility of getting into this field. There's a lot to explore, so let's get started. So what do psychiatric pharmacists even do? Well, psychiatry is all about the diagnosing, treatment, and preventing mental, emotional, and behavioral disorders. It's different from neurology, which is kind of more about like the brain diseases such as epilepsy, migraines, where psychiatry is a lot more about the behavioral diseases. Psychiatry was kind of born out of looking at, unfortunately, the mental insane way back in the 1800s. You probably have maybe seen horror movies about like Shutter Island and the difficult conditions that patients with psychiatric diseases had to go through. Well, things have gotten a lot better since through medicines and treatments and therapies, but psychiatry pharmacists specialize in recommending and dispensing psychoactive medications designed to address these mental health disorders. Psychiatric pharmacists work in a vast array of different fields, from hospitals to outpatient clinics, VA hospitals, academic institutions, research facilities, and even community mental health centers. According to BPS, there are around 1,500 certified psychiatric pharmacists, and I speculate there's a lot more practicing who just aren't certified. The typical job titles are psychiatric pharmacist, mental health pharmacist, or psychiatric clinical pharmacist. Let's talk about salary. I love playing the guessing game. Before you go on this video, what do you think the average annual salary is for a psychiatric pharmacist? Ready? Put in the comments. Pause. All right, let's look at some numbers and see what people are reporting. According to payscale.com, they reported an average annual salary of $125,000. I tend to always think of PayScale as one of the lower ends of the range of averages, and I'm honestly kind of surprised by this because ZipRecruiter said their average was $126, and ZipRecruiter looks at job postings to determine this score. The highest salaries are in places, of course, where the highest cost of living is, and we all know where that is. It's California. We found one job on ZipRecruiter with an average annual salary that was ranged from $125 to $145. They say it's based on experience, but it all comes down to negotiation power. This is following a theme with almost every one of these clinical pharmacy roles, where the salary is basically the same, if not a little bit lower than what you could be paid for a job where you don't need residency training or more experience in the community or hospital setting. I think that stinks. But the fact that this is still a 6-figure salary job, I'm going to give psychiatric pharmacy salary score a 5 out of 10. Let's talk job satisfaction. Have you ever thought that it would be very fulfilling to help someone battle through mental health conditions? Well, let's talk about the challenges and the rewards of this fulfilling career path. Unfortunately, there isn't a lot of specific information about psychiatric pharmacists, but we do know that clinical pharmacists in general have a high level of stress. There are high levels of burnout. We're talking 50-70% burnout or work exhaustion happening. But on the flip side, these fields of pharmacy can be very fulfilling because of the problem solving and the patient transformations that you can see through your interventions. One study that we often reference reports that clinical pharmacists, in comparison to hospital staff pharmacists, report a higher level of fulfillment in their work. According to one interview we found online, a psychiatric pharmacist said that the most fulfilling part about their role was building relationships with clinicians and patients and problem solving to help those patients and clinicians. The biggest challenge they reported was balancing their work and their life. This is a common theme for practically every pharmacist job, is work-life balance. I don't take that unique to this role. But we found even more to uncover from some Reddit posts of people who are practicing in this field. One pharmacist said that they absolutely adore their job and consider it the best position in the hospital. One pharmacist said they find their patients fascinating and derive immense satisfaction from helping them. Another remarked that it's less tense in comparison to other pharmacy settings, allowing them to focus more on patient care. We like to look at Glassdoor for what people are saying in the companies where they're working at. And for one company we found that specializes in mental health, gave it a 3.5. We looked at a few others and we hesitate to show you all of them just because the vast majority of them are not being reviewed by pharmacists. But I do think that this is a great tool for you to use when reviewing the company that you want to work at. One of the things that is a common thing, we talked about it in the salary section, one of the lowest scores was compensation and benefits, as they gave it a 2.7. That was not really good. I see that happening in a lot of specialties where, they don't pay you as much because it's about a cause, right? It's about helping people. And for some reason that equates to being paid less in the marketplace. If you'd like to see a story of how a pharmacist transitioned into a psychiatric pharmacist position without a residency or certification, check out this interview who went from retail to a state behavioral health hospital. For job satisfaction, we found a lot of evidence that says that people get a lot of fulfillment from helping people with these conditions. However, the work environment can be highly stressful and burnout inducing. So for these reasons, I'm going to give satisfaction score a 7 out of 10. So let's talk about the job demand. Are you going to find a lot of opportunities? Let's look at the data. We looked at Indeed.com, typed in psychiatric pharmacist, and we found 90 jobs. 73 of those were entry-level rate of around 81%, which is a little bit lower than normal. We hopped over to ZipRecruiter, and we found a lot more at 312 jobs. Now take note that these search algorithms aren't always very specific to pharmacy. I tend to take those numbers and multiplied times 60 to 70% are actually pharmacist jobs, but don't take that as a rule of thumb. One of the things that we did on ZipRecruiter though was make sure that the salary was over 125K. So that makes me feel a little bit more comfortable, but still not a lot of jobs available. There are sign-on bonuses for some of these jobs. We found one posting that had a 25K sign-on bonus. Very nice, pretty comparable even to community pharmacist jobs. We found another one with another 25K sign-on bonus. Very nice. The other question to ponder is, will you have a lot of competition for these roles? And when we looked at LinkedIn, you can see the number of applicants, the people who applied specifically through LinkedIn, and they were very low numbers. Okay, 5, 6, 1, 4 applicants. You're talking very low competition. If you are not getting interviews when you're applying to these kinds of jobs, there's either something wrong with your reputation, unfortunately, or there could be something that you're not communicating very well. The future of this profession, I think, is only going to get bigger. Mental health is a huge topic among millennials and Gen Z. I only think that means it's going to get bigger, but the reality is there's just not a lot of jobs. The health systems are not putting as much money or effort into those spaces. And so I think, the proof is in the pudding. You're not going to find a whole lot of opportunity here in comparison to some of the other clinical career paths like AmCare, or even just some of the basic ones like hospital or community pharmacist. So let's give job demand a score. There isn't a whole lot of jobs available. They do have sign-on bonuses, which is nice. And you're not going to have a whole lot of competition here, but the future of it may seem like it's bright, like there's a lot of opportunity here, and I think that's true. But again, we're not talking thousands of jobs in this space. So for these reasons, I'm going to give job demand a 5 out of 10. Let's dive into the flexibility of psychiatry. Well, we do know that there are a lot of roles that are getting into telehealth. One of my previous clients, in fact, was a telehealth pharmacist within a VA system, and she was doing all sorts of things where she could go remote. Very nice. Most of these jobs in psychiatric pharmacy are 9 to 5, Monday through Friday. Again, very nice. Most of these positions are ambulatory care focused versus like in the hospital setting. So I think that's a plus personally, but maybe some people would rather prefer to be in the hospital, which is fine. They do offer some positions in those settings. We found quite a few jobs in our search that were hybrid or fully remote roles, and it's pretty easy to get started. I randomly reviewed 3 jobs in this sector and found that only one of them required a residency and a board certification. But some of them were looking for years of experience, but only 1 to 3 years. And they also weren't specific about where those experience years were happening. So I take it to mean like hospital, community. I think it's more than enough. I think there's a lot of perks to this field. I think you get to collaborate with different providers, from physicians to nurses to techs. I think you get to meaningfully help people. Mental health is, man, it sucks. I've gone through depression myself, and it is something that feels like such a bummer. You know, it's a disease you cannot control, and it zaps joy out of your life. And my wife has gone through it as well. And to see the effect of what a provider can do in that space is powerful. It can bring someone back to life and enjoying their lives again. That can be immensely rewarding. But if psychiatric pharmacy isn't something you always want to stay in, it does offer a lot of flexibility to get into something else. You can go back to clinical pharmacy or even advance further into research, academia, pharma. There's lots of different things that you can do. So for these reasons, because of the great schedules, usually, because of the hybrid roles or remote roles and telehealth possibilities, and because of the high levels of satisfaction too, that creates great work-life balance in the right setting, I'm gonna give the best score out of the bunch an 8 out of 10. And now it's time to reflect on what the final score is. For salary, I gave it a 4 out of 10 because it's a high paying salary, but like it's not any better than community or hospital jobs. For satisfaction, I gave it a 7 out of 10 because it can be immensely rewarding, but work environments often induce burnout. I gave job demand a 6 out of 10 because there's not a ton of jobs in this space. And then for flexibility, I gave it an 8 out of 10, resulting in a final score of a solid 7 out of 10 for this field. I'd love to hear your thoughts about this. What didn't I cover? What did I miss? Was I too hard on some things and maybe too soft on others? Everyone's personal experience is different, and it's very hard to just like say universally whether you should do this or not. But these are the factors that I consider most important when evaluating a career path. Look, I'd love to hear from you what you liked. If you like this video, maybe give us a like, you know, like hit that thumb button. Like, oh, it's so easy. Just click. It's going to make you feel good. But if you disliked it, hit that dislike button and let us know what we missed so that we can improve in future videos. Thank you so much for watching this. And until I see you in the next video, take care.